We've come together because we know that setting families on pathways out of poverty is a moral imperative. And to find the right solutions, we must follow the data. The data tells us that before the pandemic, 1.2 million adults and 350,000 children in New York City lived below the poverty line. But this statistic doesn't tell the whole story. In 2012, we partnered with Columbia University to launch the Poverty Tracker, a groundbreaking study of life in New York City. Instead of taking an annual snapshot of the poverty rate, we check in with families to track how they experience disadvantage over time. By doing so, we've gained a better picture of what economic security and insecurity really means. It's not just about each family's income. It's about the real-life hardships they face. In 2019, nearly a third of adults and 35% of children struggle to afford housing, healthcare, or food. That's 2 million adults and 600,000 children in New York City who experience material hardship. And then came 2020. The COVID-19 pandemic impacted all of us, but it's those who were already at a disadvantage who were hit the hardest, pushing families that could least afford it to the brink of disaster. And as the number of cases soared, more and more families were faced with the grim reality that they simply couldn't afford to get sick. But of all the dynamics exacerbated by the pandemic, none was as severe as the crisis of racial injustice. Before 2020, Black and Latino New Yorkers were already disproportionately likely to face hardship, and the pandemic hit them even harder. While nearly half of white New Yorkers were able to work from home, many Black and Latino New Yorkers lost their livelihoods because their jobs required being on site or were in industries impacted by the pandemic. As for the men and women classified as essential workers, they too were predominantly Black and Latino, and nearly half lived near or below the poverty line. It could have been even worse. Estimates show that without government responses like the CARES Act, 1 million more adults in New York City alone would have been in poverty in 2020. However, while the CARES Act and other benefits may have curbed a massive rise in poverty, they have had little impact on the immense economic disparities between white New Yorkers and New Yorkers of color. Our research gives us a clear picture of the fight ahead. If 2020 was a year of crisis, we need to make 2021 a year not just of recovery, but of reform and renewal. So let us come together to face these challenges head on. And here to talk more about the next steps in addressing the health disparities facing our nation is the chair of the White House COVID Task Force, Dr. Marcela Núñez Smith.